Welcome to this episode of NLN Podcast Nursing Edge Unscripted, the scholarship track. I'm your host, Dr. Stephen Palazzo, a member of the editorial board of the National League for Nursing and for Nursing Education Perspective specifically. Nursing Edge Unscripted and our track entitled Scholarship celebrates the published work of select nurse educators from the NLN's official journal, Nursing Education Perspectives, and the NLN Nursing Edge blog. The conversations embrace the author's unique perspectives on teaching and learning, innovation and its implications for nursing practice, and program development and enhancement. This episode is on the issue of clinical evaluation of pre-licensure BSN students. We will discuss the author's article, First Job Workplace Stressors for New Nurse Graduates in Their Own Words, a secondary analysis. The discussion will focus on the unique findings of the authors who published the manuscript in the January-February 2022 issue of Nursing Education Perspectives, Volume 43, Issue Number 1. Our speakers today are Dr. Veronica Feeg, the Hagen School of Nursing, Associate Dean, Director of the PhD Program and Center for Nursing Research and Evaluation. We also have joining with us today Dr. Diane J. Mancino, Executive Director of the National Student Nurses Association, Brooklyn, New York. The questions we're going to focus on today are around the topic of their research paper that I just mentioned. And the first thing I'd like to ask our authors to do for our viewers is just summarize their study and the themes that emerged.
Sure, I'll take that on. One of the things that needs to be understood is the study is a secondary analysis of a large data set. And I've been fortunate enough to be able to do the annual new graduate survey for the NSNA. And as part of that role, we analyze national data on entry into practice for new graduates. We do everything from job search to job placement. Over the years, we've been adding questions related to the new job. We usually send this out by email on SurveyMonkey, which the students are used to, and we send it to thousands of new graduates. We had a very robust sample from when we get the data. So when we've added these stress questions, over the years, we've watched the amount of stress that new graduates face in the new workplace growing. In fact, it had a giant leap somewhere in 2015, 2016. One of my doctoral students had done the study and compared it with a giant leap in the amount of stress in the workplace for new grads. We attributed it to the faster pace, the sicker patients, the things that we knew from the literature, and the increased demands that were happening with all the kinds of policy things that were happening. Well, in 2017, we added these stress items again with an open-ended one. So this particular published study is the qualitative analysis in their own words of how stressful or what they perceived as stresses in the new job. So we had over 1,000, I think it's 1,400 plus responses that we were able to analyze what they said in their own words. And as the researchers that my team was, we had 3 coders, and 1,000 responses isn't shabby when you're doing a qualitative study. We had index cards, we had card sorts, we had consensus among the 3 of us, and we were able to publish a list of the highest reported, in their own words, items that new graduates reported. And I'd like to share the screen and show that just briefly so that you can see from that particular analysis is the top ranking items in their own words. Most of them, more than 100 of the 1,000 that we received, came from those high expectations and responsibility and the fear of making a mistake. But the foundation was the acuity in the workplace, that the acuity in the workplace was getting higher and that their confidence was getting taxed. So we also, when we did the analysis and coded them, we put them into clusters. So this will show you when you say, what are the 3 main themes? You can see real clearly that the 3 main themes two of them pivoted on the third. That is theme one, my workload is more than I expected. All of these items about the acuity, the realities in the job. Theme two being, I don't know everything I should know or I need to know. That's the stress of the new experience, but it's also the self-expectations. That's really important to understand is when their confidence is taxed. The early work of Marlene Kramer talks about the need to have to balance that of finding out how you can get through that personal confidence. It's the most important part, I think, now we can talk about of transitioning from the new graduate to being the professional nurse. Because when the environment is supportive on that self-confidence, then that self-confidence can be worked through with what the old classic Marlene Kramer said, resolution, so that it can move from the restoration to resolution. The third main theme that I think is pivotal, and I'm sure Dr. Mancino will talk about it too, is my relationship with others. That they're difficult as a new grad when one's confidence is low. And you can see those interpersonal relationships underneath those include communicating with providers and communicating with other professionals. All of that is taxed when confidence is low. We heard a lot of interesting, in their own words, stories of trying to adjust to the new workplace. And one of the other things that we've looked at further with the NSNA data is bullying. The kinds of things when one feels very vulnerable. So we've done a bunch of interesting things since then to try and really capture the understanding of what that first year is like for new grads as they transition in the workplace.
Great. Diane, do you have anything you want to add to what Dr. Feeg was mentioning with the work?
Well, you know, this data is kind of old compared to what we are looking at today, and the gap now that has occurred because of the pandemic. But it does, of course, serve as a valuable source to compare what's happening in the workforce today. You know, which has just basically exacerbated the issues of the themes that Dr. Feeg has identified. I believe also that, for example, the communication piece, the ability to the interactions with others in the workforce, that's something that I think we have probably more control over than the other two themes, and that can be actually worked on by the institutions that hire nurses, and you know, that very often is the tone and the culture that is set by the leadership of the employer, and it can be manipulated and changed. And I think if that were to happen, we would see a lot happier new graduates in the workforce. You know, that first year, I think, makes or breaks a new nurse. At NSNA, we've been working very hard with on professional identity formation in nursing, because we believe that as new graduates enter the workforce, having that professional identity at least you know, formed well as they enter will help them to adjust to the workplace. I mean, don't forget, the clinical sites, clinical has been decreased, not just because of the pandemic, but even before that, we placed the simulation. You know, once we got the word, I think once that academic settings got the word that 50% of simulation would be okay, they all jumped on that opportunity because it's harder and harder to find clinical placement for undergraduates.
Oh, yeah, we're at a critical place with placements right now. It's always been terrible, but it's really, really difficult right now.
And you also have a shortage of faculty that enters into, you know, into the equation. So I think there's, you know, there's a lot to learn and a lot that can be done that that we can work on.
You mentioned earlier when you were discussing your study about this data was collected obviously before the pandemic. So that leads right into my next question. The data from the study was collected before the pandemic. What has been the impact, in your opinion and your experiences, of COVID-19 that confirms your study's findings related to role strain and the new graduate? And I have to point out, obviously, we're talking about new graduates, but this role strain is very evident in our seasoned nurses too.
On everyone, you're absolutely right. We were able to put a few sentences back in there over the process of getting this into print. It's really a problem. We need to have more agility in publishing, because we were putting that back in. Now we have a baseline too that we will be looking at, because we can look at this. We've collected the same data in our recent last 2 years, and we can speak to the newer findings, which are just the same findings exponentially, adding to the stress of the environment. We have not just experience, but data to support that. Over the past 2 years, hiring and getting jobs for our new graduates came to an end. We had a horrible drop in employment in 2020, as you probably can assume, and hospitals, whatever they needed to do, didn't hire new grads for a long time. They were terrified when they did get hired. They had been stopped in their clinicals cold in March and April. We have that data. We actually published a study in Dean's Notes that I would refer any listener to, because it really was the impact on students during the height of the pandemic because of their clinical changes. Those particular findings informed us about how we predicted, given we may have started with a shortage, but having theoretically an oversupply, we would see a drop down in the 2021 graduates. And we're asking the same stress questions and the same confidence questions in 2021. And I can confirm that what we were looking at with the acuity and the environment and communication are now exponentially changed because of the situations that the nurses are facing with their shortages and their needs. So the workforce statistics and the workforce emphasis in the next year for both in the clinical environments and nursing education are going to be drastically changed. We've had to maneuver and pivot in so many ways. So, I'm happy to say we have other data that say this wasn't wrong then. It's a baseline, and it's now even more so a problem for the new grad.
Yes, and it's interesting. What we're dealing with now is this influx of interest in nursing. I know I've heard applications are up across the nation because of the pandemic, right? And some of the shifting of the workforce away from some of the service industry jobs that were hit hard by the pandemic, looking for other options. Yet we also know in the research that we lose a lot of nurses in that first year of practice. And so what do we do in the between part there? When I talk to colleagues, we talk about, residency programs have to look different for these new grads coming out during the pandemic that they did previously, because there's going to be some gaps in knowledge based on the lack of actual in-clinic experience. Now, it'll be interesting to see the research that comes out in the next several years looking at how did the pandemic impact education, using more simulation, virtual simulation, et cetera. I'm sure we'll see some studies coming out in not too distant future. But that leads to the question, we've been discussing this difficulty in transition to practice for decades. It's not a new topic. Why are we unable to make inroads in this area? What are the solutions to this?
I'd like to defer that question to my colleague. We just did I was part of a faculty forum on transition to practice. So given what she put together to be able to address that and the incredible interest in that particular area of study.
So you have a solution, Diane?
You know the old saying, it takes two to tango. You need academia and you need the practice settings to start tangoing together to solve the problem. and I'm not sure what that means. But if we don't join forces and work together on this, we have students who new graduates who have entered the workforce with zero contact with patients. And as we mentioned earlier, the fact that there's just not enough clinical placements to give students those opportunities to learn how to be with patients, to be at the bedside, to understand how to take the knowledge that they have learned in their academic setting to the practice setting. And then when they land there, they don't have the support that they need, or the support that they do have is not prepared well enough to support them, to understand what their role is. It's a very complex issue. It's not, we have a shortage now, a severe complex shortage. We have nurses who have taken to the road to enhance their nursing journey by doing travel nursing. And the interesting thing about that our data is showing is that this is on the rise. The new graduates have this as part of their future plan. They see
absolutely
what's happening. And how is that how is it now impacting the workforce and the practice setting? And how are we going to plan for this in the future? Because it's not something that's going to go away. And I think it's something that we're going to have to face in terms of the culture, because it changes the whole culture of the units where people are practicing. What are the employers doing about that? I haven't heard exactly, except that I know that there's a huge number of travel nurses replacing staff nurses, and the staff nurses see that they're getting paid 2-3 times as much money, so they just quit their jobs and they come back to the same
as a travel nurse. Right.
So it's it's very complex.
Very complex, correct. What do you think about solutions happening at the legislative level, policy enactment?
Well,
I'm hoping, I'll pitch to Diane in a minute, but I'm hoping that, I know in our state that nurses become part of the conversation on workforce dealing with the pandemic, and in our state, and we're both from the same state, that usually translates to the legislature finding ways of improving that. And then I hope that finds its way to nurses at the bedside, because there's been a shift of where the emphasis, even at the federal level, has been to increase the productivity of nurse practitioners. And that's important as well. But what we've seen in our data as the culture in the hospital setting and the environment itself is playing an important role for a new nurse who isn't going to stay at the bedside, isn't going to want to. Some places I know of are trying to look into, some of the enlightened leaders in the hospitals in this area have looked to trying to think in terms of longer career planning for new graduates, not thinking in terms of the residency or the preceptorship, but in terms of keeping them as being part of the institution and career planning of where they want to go. I think that's important. I think Diane called it takes two to tango. It also, feels like a ping pong ball where education goes, it's your problem, and workplaces know it's your problem, and they really need to get together and find some solutions together. So I agree with that.
Well, the National Council of State Boards of Nursing has looked at mandating or recommending, because the NCSBN is a recommending body. States are obviously independent in programs and the decisions that they make, but they have looked at recommending requiring residency programs in all of the new work settings for new graduates, and I think that. And it has to be, a quality residency program. But our data actually shows some interesting results on students that are in residency programs, which we're not ready to discuss at this point. But
a little teaser there.
A little teaser.
The residency programs, the onboarding is so important. And the recognition by the clinical sites that students, they're going from taking care of one or two patients during their clinical experience to taking care of 5 or 6 or whatever. And I don't think, for example, that legislating a patient to nurse ratios is the answer, because all that's going to do is wind up closing units. Because you're not going to have those. They're just not there. There's just not enough nurses to have those that kind of legislative approach. So now I understand that there's been some approach to the federal government about regulating the travel nurse industry. So that's an interesting idea. But is it a good idea, just to have the federal government mandating changes in travel nursing? It's an interesting thing. We need to watch it. But I don't know what the answer is. I guess that's the best thing that I can say. But we have a lot of work to do on this on both ends, the academic end and the practice settings. And it's going to take nursing leadership and healthcare leadership to solve. It's never going to be solved, but it can be improved. And we have to put our heads together and see what the best way to manage this problem is, and get more. This is one problem I haven't figured out the answer to, and that is how to increase the number of faculty and how to replace the ones that are retiring. When nurses can make so much money in the practice setting, they're not going to become academics.
There's so many issues right now, and this one is another one we could talk about for a half hour. Why is it so difficult to attract new nurse educators, right? A lot of it, we think it's money, some of it's money, a lot of it is the culture of academia. And, nursing and civility transcends all areas of nursing, not just in the practice site. And so there, I do some work in nursing and civility, so I know this is definitely an area that is of concern, and of concern for new graduates too. So some final thoughts. What would you each say to a new nurse graduate entering the workforce?
I'll speak to that to start. What was a surprise to us in our COVID study is that despite all of the problems, even those who were facing, as they were going to graduate, they were about to graduate, there was still what we call the silver linings of wanting to be a nurse, wanting to serve, wanting to take care of people. And that I think wasn't extinguished even in the worst of times. So I would play on that in my message to a new graduate of the challenges ahead, but keep that fire burning of the desire. And we saw some of that in some of the comments. There would be people were not shy to write very long passages about how horrible something was. And then they'd have at the end of it, but I did this to be a nurse, and I want to be a nurse. And I would be on that side of my blessings. I launch a lot of new grads in the programs. I see a lot of them, and that's my message, my takeaway for them.
Yeah, I think we have to strengthen the onboarding for sure. And mentorship is very important. That's another piece of the study that we're not talking about now, but not enough new graduates are graduating with a mentor or a guide or somebody that they can turn to discuss their issues and their problems and their concerns, which is, I think, so very important. Not just one mentor, but a mentor for everything that you kind of need in your life. It's the passion, as Ronnie said, is there, and we don't want it to be extinguished by having a bad experience. I think that the leadership in both academia as well as in the employment setting is extremely important. The leadership has got to get involved. Shared governance is another important, strengthening that shared governance model so that nurses have some control over their unit, over the practice in their unit. I think that's, the decision-making piece. If they feel that everybody else is making decisions for them and they have no input, then they're going to feel kind of helpless and hopeless. So I think strengthening the shared governance model so that they do have a voice in their practice and engaging them with mentors. I think that the mentorship issue has become a problem during the pandemic because of the isolation of the students and the faculty and the practice settings, and a lot of inability to find mentors or to have people take you under their wing, so to speak, as you graduate. So hopefully those things will improve, but we have a lot of work to do.
Well, I want to thank you both so much for joining us in this conversation. I appreciate your time and expertise in sharing your work and broadening our understanding of this very complex issue that doesn't obviously have easy solutions. And maybe some people who are watching this can go away and think about some work they want to do in this area moving forward. To our listeners, again, if you have not had the opportunity to read this work, you will find the manuscript published in Nursing Education Perspectives, and that's in the January-February 2022 issue, volume 43, issue 1. And I encourage you all to take a look at it. It's a great study that builds on some of the work that we know is happening in this area for new graduates coming into practice. Again, I want to thank Veronica and Diane for their time. Much, much appreciated.
Thank you, Stephen.
Thank you.